Good wishes, dear children. How are you all? I hope you all are well and good at your places and enjoying your learning sessions with me, Navneet Kaur, your environmental studies teacher. So, dear children, how are you all? Fine, that's good. That's good. So, are you saying something? You're asking me something? Okay. What am I doing? Children, I'm sanitizing my hands because sanitizing your hands and washing them regularly is really important. I don't want to take any kind of risk. What did you say? Oh, you want to know more about this? Okay, let me tell you. See, when I'm working, I'm touching these objects which other teachers may have also touched, or other people or some student may have also touched. And by chance, if someone among those has been suffering from some communicable disease, then those viruses, those germs are already on the object. Now, if I touch the same object and then I touch my face, all these places, my eyes, my nose, my lips or my ears may get in touch with the germs on the hand or the viruses on the hand and may get inside the body, and even I may fall sick. So, this is the reason that we have to keep our hands neat and clean. Always keep your nails trimmed. So, dear children, now I think you will all take care of your hands and keep them neat and clean always. Ah, my God, this was a mosquito biting me. Anyone please come here and just spray some mosquito repellent? I am, not going to take any risk. Why? You don't know? Mosquitoes can spread a lot of diseases, my dear children. Let's talk of all this today. So, dear children, now be aware. Mosquitoes can spread all these diseases. Malaria, yellow fever, Japanese encephalitis, dengue, chikungunya, West Nile virus, and much more. So, dear children, we have to protect ourselves from mosquitoes' bites as well. Mosquitoes spread diseases through their bite. Children, mosquitoes are blood suckers. When they bite us, they suck our blood. Therefore, we can say that mosquitoes are the vectors. Now, what are vectors? Vectors are the living beings that carry diseases between animals and humans. So, children, now see, one of your friend has come back to the school after so many days. Let's see what all he's talking with his friends. Come on, let's see.
How are you now? Asked Aarti. I'm alright, Rajat replied softly. Jaskirat said, You must have played a lot while you were at home. Rajat said, Who wants to play when you have fever? On the top of it, I had to take a bitter medicine. I even had a blood test. Jaskirat immediately said, A blood test? Why? It must have been very painful. Rajat replied, Actually, when the needle pricked my finger, it felt like an ant bite. They took 2-3 drops of blood and then sent it for testing. That's how, when we come to know that I had malaria. Nancy said, But you get malaria when a mosquito bites you. Rajat replied, Yes, but we find out by the blood test. Jaskirat asked, There are a lot of mosquitoes in my house these days, but I did not get malaria. Nancy said, Who says that every mosquito bite causes malaria? Malaria spreads only by the disease-carrying mosquitoes. Aarti said, All the mosquitoes look the same to me. Rajat says, There must be some difference. Nancy said, Did they take the blood from the place where the mosquito had bitten you? Of course not. How do I know when and where The mosquito bit me? Nancy said. But how could they find out that you had malaria by your blood test? Do you think they could see something in the blood? Dear children, now look at this picture. Taking the blood on the glass slide for test, malaria spreads through female mosquitoes named Anopheles. Look at this picture. This is female mosquito Anopheles. Let's visit Dr. Mariam's lab. Dr. Mariam looking at the blood slide under the microscope. This microscope makes things look 1,000 times bigger. The details inside the blood can be seen clearly. There are some microscopes which make things look even more bigger than this one. So dear children, what did Nancy ask? Nancy asked, do you think they could see something different in blood? What do you think? Yes, of course. Malaria parasites can be identified by examining under the microscope. A drop of patient's blood spread out as a blood smear on a microscope slide. Prior to examination, the specimen is stained to give the parasites a distinctive appearance. So now you know how they find out that you have malaria by your blood test. Okay, dear children, look at the report of the blood test given here. Which words in the report help us to know that the person has malaria? Look, clinical pathology report, central government health scheme. Name Rajat, age 11, sex male, diagnosis, fever with chills and rigors. Malarial parasite found in blood sample. Here is the signature of the pathologist. Now we have read this clinical report. So, which words in the report help us to know that the person has malaria? Yes, here the result has been clearly written. Malarial parasite found in blood sample. This means the person has malaria. And also look at the symptoms. This is one of the symptoms of malaria. Fever with chills and rigors. So dear children, this is how the report clarifies that the person has malaria. Now let us talk about the medicine for malaria.
Children, from early times, the dried and the powdered bark of the cinchona tree was used to make a medicine for malaria.
Earlier, people used to boil the bark powder and strain the water which was given to patients. Now, tablets are made from this. Now, let's go back to the discussion that the students were doing. Let's listen what they are saying. Aarti said, I also had to get a blood test done, but they took a syringe full of blood. The blood test showed that I had anemia. Rajat asked, what is that? Aarti replied, the doctor said that there is less hemoglobin or iron in the blood. The doctor gave some medicines to give me strength. He also said that I should eat jaggery, amla and more green leafy vegetables because these have iron. Nancy asked, how can there be iron in our blood? Jaskirat said, there was something about this in the newspaper yesterday. Rajat started laughing. So then you ate iron or what? Aarti said, silly, this is not the iron used to make these keys. I don't know exactly what it was. After I ate a lot of vegetables and whatever the doctor had said, my hemoglobin went up. Okay, dear children, now let me tell you. Iron is an essential element for blood production. About 70% of our body's iron is found in the red blood cells of our blood called hemoglobin. Hemoglobin is essential for transferring oxygen in your blood from the lungs. Now you know which iron are these children talking about? Okay, let's move ahead. Look at this news report, dear children. Anemia common in Delhi school. 17 November 2007. Thousands of children studying in the municipal corporation schools in Delhi suffer from anemia. This is affecting both the physical as well as mental health. Due to anemia, children do not grow well and their energy levels are low. This also affects their ability to study properly. Now, health checkups are being done in the school and health cards are being made for all the children. Anemic children are also being given iron tablets. Dear children, look at this report. Clinical pathology report. Central Government Health Scheme. Name Aarti. Age 12. Sex female. Diagnosis anemia. Hemoglobin is 8 grams per deciliter. Normal range is 12 to 16 grams per deciliter. Now look at Aarti's second report after she had gone through some treatment. Name Aarti. Age 12, sex female and diagnosis anemia, but the hemoglobin level now is 10.5 grams per deciliter and the normal range is 12 to 16 grams per deciliter. Though it is not in normal range, but still it has increased from 8 grams per deciliter to 10.5 grams per deciliter. So look at the Aarti's blood report and find out the minimum required hemoglobin. Yes, minimum required hemoglobin is 12 grams per deciliter. How much did Aarti's hemoglobin go up and how long did it take for that? Yes, it went up to 2 grams per deciliter. And how much time did it take? Look at the dates in the report. The first report is dated 20, the month is 6 and the year is 2007. And on the second date, the date is 15, the month is 9 and the year is same 2017. Okay dear children, now look at these iron rich foods. Sesame seeds, black beans, cooked spinach, dark chocolate, garbanzo beans, kale, sun-dried tomatoes, kidney beans, Swiss chard, sunflower seeds, lentils, prunes, potatoes, olives, lima beans, black-eyed peas, and there are many more. So dear children, you should take a lot of iron if you are anemic. Let's go back to these children who were talking. Let's go and listen what their conversation is up to now. Jaskirat says, "There is a poster on malaria just outside our class." Oh, why don't we go with Jaskirat and see that? Okay, everyone, come, let's see that poster. The poster starts with the question, "Are you inviting mosquitoes?" Oh, I don't want to invite mosquitoes. Let's read ahead. Beware. Yes, we have to beware. Let's see. They spread malaria, dengue, chikungunya. My God, these are deadly diseases. Let's read ahead. Don't let water collect around your house. Okay, I won't do that. Fill up the pits. Okay, I'll do that. Keep the water pots, coolers, and tanks clean. Okay, I'll do this also. These should be dried every week. Okay, I'll take care of this. Use mosquito nets to protect yourself. Okay, I'll do this. Spray kerosene if water has collected at some place. Rajat says, the poster has something about larvae. What are these? Nancy replies, they are baby mosquitoes, but they don't look like mosquitoes at all. Aarti said, where did you see them? Nancy replied, there was an old pot lying behind our house. It was full of water for some days. When I looked there, I saw some tiny thread-like grey things swimming. I was surprised when Mummy told me that these had come out of the eggs which mosquitoes lay in water. They are called larvae. I also heard something about this on the radio. Rajat asked, what did you do? Nancy replied, Papa immediately threw away the water. He cleaned and dried the pot and kept it upside down so that no water would collect. Jaskirat came and said, Shazia auntie told me that even flies spread diseases, especially stomach problems. Rajat says, but flies don't bite. Then how do they spread diseases? Now this is a question that is something really interesting. How do flies spread diseases? Any guesses, dear children? Children, you know, the common housefly can transmit the pathogens that cause typhoid fever or cholera, etc. The disease causing agents can be transmitted by the body of hair, which are transmitted to food and surfaces when the fly lands on these surfaces. So, children, now you know that you won't let water collect anywhere in and around your house. Okay?
Monsoons are here. Rain, rain, go away. Little Johnny wants to play. Rain, rain, go away. Little Johnny wants to play. So you all want to play in monsoons, but you are not allowed to go out because of the rains. So during the rain, what happens? Yes, there are lots of spaces where the water gets collected. And this is when mosquitoes get a chance to have a treat. Yes, such seasons are actually treat for mosquitoes. How? Because monsoons are the breeding season for mosquitoes and mosquito-borne diseases. These mosquitoes are everywhere here and there. Wherever the water is stagnant, they get a chance to breed, and then they have their treat on us. So, what is important? How can we prevent such mosquito-borne diseases? Yes, we need to make sure that there is no water collected in and around our surroundings.
Ronald Ross was a scientist. Let me tell you about something interesting, a very interesting incident. A scientist peeps into a mosquito's stomach. This interesting incident took place almost 100 years ago. A scientist found out that mosquitoes spread malaria. Let's read about this discovery in his own words. My father was a general in the Indian Army I studied to become a doctor, but what I really liked was reading stories, writing poetry, music, and drama. In my free time, I enjoyed doing all this. In those days, thousands of people used to die from a disease that we now call malaria. The disease was found in areas where there was a lot of rain or in the swampy places. People thought that the illness was caused by some poisonous gas that came from the dirty, swampy areas. They gave it the name malaria, which means bad air. One doctor had seen tiny germs in the blood of one of the patients when he observed it under a microscope. But he could not understand how these had got into the patient's blood. My professor had some ideas about this. I think that these may be carried by some kind of mosquito. As his student, I spent all my time chasing mosquitoes to catch and observe. We used to carry empty bottles and chase mosquito after mosquito. Then we would put the mosquitoes into a mosquito net in which there was a patient of malaria. The mosquitoes would have a feast biting these patients. The patients were paid 1 anna for allowing one mosquito to bite them. I will always remember those days at the hospital in Secunderabad. How we used to cut open the mosquito's stomach and peep into it. I would spend hours and hours bent over the microscope. By night, my neck would be stiff and my eyes could not see clearly. It should be very hot, but we dared not fan ourselves, as all the mosquitoes would fly off in the breeze. Once I also fell ill with malaria. I spent months like this with the microscope, but could not find anything. One day, we caught a few mosquitoes that looked different. They were brownish with spotted wings. When I looked into the stomach of one of the female mosquitoes, I saw something black there. I looked closer. I saw that these tiny germs looked just like the ones that were found in the blood of malaria patients. At last we had the proof. Mosquitoes did spread malaria. In December 1902, Ronald Ross got the highest award for his discovery, the Nobel Prize for Medicine. In 1905, even as he lay dying, Ross's last words were, I will find something new. Okay, dear children, now tell me, what do you understand by
Anna.
Do you have an idea? So you just read that an
Anna.
was given to the patients who allowed mosquitoes to bite them, right? So,
What do you mean by Anna?
yes,
Anna.
Anna was the form of currency used earlier in India. Hey children, this is your homework time now. So, we are going to make a poster. We just had an example of the poster outside that class, how malaria spreads, what are the precautions that we need to take, right? So you have to make a poster in which you are going to talk about any disease that you know. You are going to tell about the causes for those disease and what precautions can you take to avoid that disease and what are the symptoms of the disease.
Children, now that we know so much about the mosquitoes and how they spread diseases, this is the right time to stop a treat for mosquitoes. So let's come on and join hands for this purpose, that we will keep all our surroundings clean, neat, and will stay fit. How are we going to stay fit? By eating healthy, by exercising regularly, and by keeping ourselves clean, our nails clean, and our hands free from germs, and not eating uncovered food from outside, and much more. Now you know a lot more about it. So, with the hope that you will take care of whatever you have learned and live a healthy life, I'll be back again with some other interesting and informative chapters for you. Till then, take care.